his cheeks.
Now you might think, as I do, that having a facelift at 20 is somewhat extreme, but it's all the rage in Hollywood. It's a special kind of revolutionary facelift that doesn't involve a nip or a tuck.
23-year-old Claire Frazier is young, free, and not going to be single for very much longer. She's engaged to be married to Gary. He's a casting agent and a cosmetic surgery veteran.
I've had my upper and my lower eyelids done. I've had a full facelift. I've had some liposuction. I've had laser treatments on my face.
Looking young is something this couple find important. So Claire is getting a facelift, a non-surgical ThermaCool one. Even though it costs $2,000 for a one-hour treatment, this new technology is in demand.
We, of course, have a number of celebrities who come in and have this procedure and other non-invasive procedures done even while they're filming. They'll want a facelift, but they'd like to postpone it a couple of years, and so they'll have a ThermaCool or two done. That's what I'm doing. I'm putting off my facelift with a ThermaCool. I'd like to have a facelift now, but I'm too busy.
Feels like a little shock and like little heat waves going like tick, tick, tick.
But if there's no surgery, how does it work?
ThermaCool will tighten the skin, and while tightening will get rid of some of the wrinkles. The radio frequency heats up the tissues that are deep to the skin. That heating causes contraction of the deeper skin, or the dermis, and also causes formation of more collagen in the skin.
With this facelift, Claire will not see the full effect of the treatment for at least 6 months, just in time for her wedding.
Okay. How was that?
Easy.
Yeah?
Yeah, so fun.
Okay.
I'm bewildered by this. I don't understand it. How do radio waves give you a facelift?
Well, this is a great phenomenon. I love where we're going with plastic surgery. What radio waves do is they create heat, but they penetrate the skin so that the heat is below in the dermal level. And what that does is sort of create a suboptimal injury, and as a result, you get a little scarring. It's that scarring that sort of tightens up the face.
So is it at all similar to the acid peel, or is it different from
Well, it's much different than the acid peel, because the acid peel is taking off top layers of skin to expose younger skin. What this is doing is actually tightening up the skin and getting rid of wrinkles.
Is it possible that you could get burned as a result of it?
You could possibly get burned, but to be perfectly honest, complications with this procedure are so small that, I've never heard of a case like that.
So we've seen this being done on 20-year-olds who look to me as if they've got flawless skin and terribly young faces anyway. I'm 42. If I were to have that procedure, would it actually show any difference on my face?
Well, I think it would show a difference, but I think that would be very subtle, and I think that's what 20-year-olds are after. What you have to understand